Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I am so happy to have as our guest, Dr. Leslie Meyers. Dr. Meyers is a licensed and board-certified naturopathic doctor who specializes in women's health, gastrointestinal issues, fertility, chronic fatigue, insomnia, and anxiety and depression. After completing her doctorate degree from Bastyr University, Dr. Meyers practiced as a primary care doctor in Seattle, focusing on women's health, fertility, GI issues, and the other things that we mentioned. And then Dr. Meyers moved from Seattle to Asheville, North Carolina, where I bet it's a lot cooler today than it is in Seattle. Thank you so much for joining us today, Dr. Meyers.
Thank you so much for having me. I'm excited to be here.
So you had asked at some point in our conversations how I found you, because I saw you on, I have been doing holistic medicine since 1964, and I've even taught at Bastyr and Southwest and many of the naturopathic colleges. And you were basically doing other kinds of presentations and lectures in some of those group presentations. So I saw your name there. I said, wow, because I really enjoy talking to naturopaths, and in particular, those who went to Bastyr, which is, I would say, kind of the Harvard of the naturopathic colleges.
Well, that's great. And I'm so glad that you did see me. And that's really cool that you taught at Bastyr. I love Bastyr.
Now, let's go back in time and let's talk about a little bit of your path that got you to become a naturopathic physician.
Well, when I was a teenager and then in college, I suffered from my own bouts of IBS and had periods of anxiety. And really, that was what drove me to go to naturopathic medical school. And when I did that, when I went to Bastyr, I really learned how to heal my body and to have true health, and through nutrition and fitness and herbal medicine, and just understanding what was going on in my body and how I could help myself and be empowered to do what was going to help me feel good.
So you were your first patient.
I was my first patient. And I always knew that I wanted to be someone that was helping others. And at first I wanted to be an MD, and then just kind of came into this route and never looked back.
Well, I think it's really something that should be much more broadly recognized and used, because naturopathic physicians are highly trained in conventional understanding of disease processes. And you know a lot about pharmaceuticals, even though that's not your, focus of choice, which it should never be. I really think naturopathic medicine is the ideal mainstream medicine. That's what it should be, to wear first. Because when you say herbs, Dr. Leslie, I know the kind of botanical medicine education you've got. And we're not just talking about, using chamomile tea to relax, which is a good thing. By the way, this show is called Herbally Yours. So I love bringing up herbs, of course. But you're actually taught in Bastyr what I would call botanical pharmacology, where you're taught to understand why an herb works, like at the membrane level, what kind of mechanism of action is known to occur. So it's a really deep understanding of botanical medicine.
It's true. And botanical medicine, there's so much knowledge in there from forever, thousands of years of knowledge there. And it's just such a gift to be able to use it. And you're right, Bastyr really taught us on a molecular level what the botanical medicine was doing, so that, we can really have an understanding.
And so good, because you're also introduced to homeopathy, nutrient therapy, which is nutrition. And I really think that should be the standard of practice for everyone first, and then we can use pharmaceuticals later if necessary.
That's what we're doing. It's the pharmaceuticals are really for when we really need them. Thank goodness we have antibiotics. Thank goodness we have pharmaceuticals and surgery, but we don't always need them as the first step. And oftentimes nutrition and fitness and herbal medicine, these things can do so much. And it's really ingrained in our society to go to the doctor to get some medicine that's going to fix you before even thinking about, hey, what am I eating? Am I stressed? Like, what is really causing this? And can I reach out for another kind of help to really bring me through lifestyle changes that are going to affect my health, not just at this little problem that I'm looking at right now, but with my whole body and my whole person. So the changes that you make, the things that help with naturopathic medicine that people use aren't just helping that one little problem that you came in for. They're helping you to be more balanced emotionally, for your gut to function well, for all of your hormones to function well, so that less problems occur in the future.
And also, it's completely science-based, as well as having such a low incidence of adverse effects, which is one reason naturopathic medicine is very much superior to just plain pharmaceutical intervention as being your only method of choice.
Right. And we can know, on the rare occasion that there are interactions that are going to occur with drugs or there are potential side effects, we generally have an idea of what that's going to be and take precautions with that.
Right. And when you say we, you mean trained naturopathic physicians.
Right. Correct.
Because there are a lot of people who just say they're, what do they call themselves, a health coach. And they have no training like what you do, which is deep, years and years of school. And now you're in North Carolina now. Is North Carolina a licensed naturopathic state?
They're not. We're working on it over here, but they're one of the states that are not quite licensed. I hope they will be soon. So what that means is that in the state of North Carolina, we don't treat or diagnose. We can't use those words. And unlike when I was practicing in Seattle, we can't prescribe pharmaceuticals. So that's okay though, because it's much more fun for me to do all the other stuff and just refer out to someone's PCP for them to do all the busy work that we used to have in Seattle, with annual exams and keeping up with prescriptions.
Right, because you could be a primary care physician. And there are several states that do recognize naturopathic physicians as primary care physicians, such as my partner, Dr. Eugene Zamperone. And he's a Bastyr graduate and also one of the people who started the school in Bridgeport, Connecticut. And he actually could take health insurance and act as a primary care physician in Connecticut. So it's more of a political difference than anything. But I hope all the states catch up soon.
Oh, for sure. It's, each year it seems like another state is licensed.
Right. But it takes a lot of work. You have to be kind of politically activated. And it sounds like you've worked it out so that it's fine for your practice and you're still able to really help a lot of people. What made you come up with this beautiful name, Waterleaf Naturopathic Center?
Well, actually, my wife came up with it. She's also a naturopathic doctor, and we have our practices together. And so she had Waterleaf before we joined. And so then we just kept her name. But she just loved it. She just loved the name Waterleaf. I don't know. She just liked it. It
does give you a real feeling of soothing, bringing in the water. And also in naturopathic medicine, there are a lot of what's called vata cures, which is water cure, where we use hydrotherapy and other kinds of water that's very deeply ingrained in the ancient naturopathic physicians, according to Dr. Bastyr. And then the concept of leaf brings in healthy food and brings in herbs. So it's a beautiful name.
Thank you so much.
Yeah, so tell your wife that for me.
I will.
And on that topic, since you brought it up, we are right in the middle of Pride Week. So that's really interesting. How do you, as let's say a couple, both women, how is the reception for that in North Carolina? And Asheville, of course, in particular, is a very progressive city.
It is. And so it's great here. Outside of Asheville, it might be a little bit different, but things are getting better all over the country. But here in Asheville, there are so many families with same-sex couple parents, and we have 2 daughters. So it's just been a really nice community to live in.
And I want to ask you a personal question. You didn't know this was coming. I'll tell our audience, because this is just from me, because I do so much intervention with people as well. You described the fact that you had so much IBS and other kinds of issues when you were younger until you discovered, naturopathic medicine and changing your lifestyle. It really helped you, like it's also helping your many, many patients and clients. Do you feel that struggling with your gender identity as a young person might have added to that, kind of aggravation that led to gastrointestinal problems?
I would say on some level, like with my sexuality, sure. And definitely. And I think that anytime somebody goes through something that's emotionally taxing and hard and gets through it and figures it out, then they have like golden nuggets to offer other people. So I feel like I have a good understanding when people are going through difficult things, so that, I've been through stuff and it's always nice to be able to talk to somebody else that's been through stuff. So it's use that.
It is, because now, of course, you're in your life and you've worked that part out and you're comfortable with it and you're in a community and, and you're a mom. And so it's years ago, but I just pick that up because you were talking about those issues when you were younger. So let's talk about PCOS, one of your many specialties. What is PCOS?
So PCOS is polycystic ovarian syndrome. So this is a condition that it is with women, and it is where there's a hormonal imbalance, where there's high androgens or testosterone and or insulin resistance, so blood sugar issues. And what can happen with that? The symptoms that people have with that are that their menstrual cycle can be off. So maybe they just get their period twice a year, or they get it every 6 weeks and then every 2 weeks. They can have infertility, black hair growth on their face. So maybe it's just a handful of black hairs on the chin, or maybe it's a lot on the face or chest. Weight gain in the truncal area, so in the tummy in particular. Acne, cysts on the ovaries, which you can find in an ultrasound, or you might know if you have them if during ovulation in the middle of your cycle you have a painful area in your lower abdomen on the side. You can also have thinning hair. And the thing is that you don't have to have all of these symptoms. You can just have a couple, or you can have most of them. It depends on the severity of what's going on. And if you, in terms of labs, what will show up is high testosterone or high blood sugar, insulin. Those are the main things. And also, if you're really looking for it, you can test for LH and FSH. They're 2 other hormones, and your ratio will be high. Your LH to FSH ratio will be higher than normal.
And what about visualization through a sonogram? Do they ever see, additional cysts in the ovaries as well?
Yes. So that will show cysts on the ovaries, but again, not always, because you don't have to have all the signs or symptoms.
Oh, right. So just because someone did get a sonogram and they were not able to find cysts, that does not necessarily rule it out if they're having other issues that you listed.
Even though it's called polycystic ovarian syndrome, that's really just the name. You don't have to have cysts on the ovaries.
Well, that's enlightening, because those are annoying symptoms, especially because they usually kind of occur in puberty.
They are, yeah. And it can start then, especially if you have a strong genetic component. But it can also start in your 20s or even in your 30s or later. And it can be quite confusing. People can start to gain weight and they don't know why. Their period can disappear sometimes, and it can be confusing and frustrating. Or they're having trouble getting pregnant and they never knew that they had PCOS before.
Well, I want to tell our listeners that you're listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and today my guest is naturopathic physician, Dr. Leslie Meyers, and you can find her at waterleafnaturopathic.com, a really beautiful website, and wonderful discussion that we're having here today. And I'm sure you focus, Dr. Leslie, on many kinds of women's health issues, as you said, like infertility also. But we're talking about PCOS. How common is PCOS?
It's very common. It's very common. And especially something called soft PCOS is very common, which is also called PCOD, polycystic ovarian disease. So the difference is the S and the D. So PCOD is really a milder version of PCOS. And so I see a lot of this softer PCOS in my office where women are coming in and they're struggling to get pregnant, or they're having a lot of weight gain or acne that they're unhappy about, or they're like, my period just stopped and I don't know why, and I know it's good for me to have a period. So it's very, very common, and more common so because of what the changes that are happening in our society. And also,
well, wait, let's talk about that. Why is it becoming more common?
Because, this is from my point of view.
Good. You're the guest. We want, and you're the doctor. We want your point of view.
I'll tell you what I think. So, of course, nutrition and fitness are a big part of it. And genetics play a part too. But what I see is really making a big shift is the stress. So, our sympathetic nervous system is not supposed to be activated as often as it is. So this is our fight or flight mode. This is our stress mode of our nervous system. And it is on quite often for most people in Western society, just from the dings on our phones that come through, or from sitting in traffic, or, a test you have tomorrow, or your 80-hour work week you're working, or even 40-hour work week where you're working and then you try to get home to cook dinner. It's a stressful life for many people, and there's a lot going on. And so that really affects the whole hormonal system. It affects your sex hormones. It affects your stress hormones, of course, like cortisol. It affects your thyroid and your insulin. That's another hormone. So all those hormones talk to each other all the time. And what I find is that PCOS can often come on after a couple of years of big time stress. And then you see it come on. And so that's an important part of healing too, helping people with stress.
Now, how do you feel about things like xenoestrogens and pesticides and chemicals on food that's not organic? Because they definitely have a hormonal component and often will even fit into the same receptor sites.
You're so right. They sure do. And that's really important too. And the more that we can eat healthy food, even when they have toxins in them, and the more that we can, de-stress, and the more that we can exercise, that's going to help us, and have healthy bowel movements. Those things are going to help our detox pathways to work well so that we can tolerate the toxins that are around. So that the daily toxins that we experience on a daily basis don't affect our bodies as much. But when we don't have all that in play, those things can build up and really, really affect our hormones. It's true. Avoiding plastic is a great place to start. Not having a plastic water bottle. Plastic leaches, estrogens constantly. So, I tell all the men in my practice, I say, you definitely don't want to have plastic bottles because that's giving you estrogen basically. And that's an incentive for them to stop using them. But the women too, of course. And so you can use clean canteen water bottles, or even like a glass juice bottle that, you have recycled.
Yeah, that's what I use. I actually just use a glass bottle,
Right.
And that's completely different because it's not going to have that plastic leaching. But also, how about thinking about buying food that's like organic? One thing that I love about Asheville is there's so many farm stands, and it's very easy to get really excellent food there, but not necessarily true everywhere.
It's so true. And when you're not going to the farmer's market, you can, at the store, you want to focus on buying organic dirty dozen. So there's a vegetable and fruit list called the dirty dozen, and those are the ones that have the highest pesticides. And so buy those organic, and that's a great place to start. And then, for your meat, grass-fed meat, organic meat. For your chicken, you want to go for pasture-raised chickens or organic chickens. And same with the eggs. And your eggs are just going to be even more yellow and more tasty. And for your fish, wild-caught fish is best.
Right. It's all, I mean, so much of the food supply is really unbelievably toxic. And of course, some people cannot make that jump to the extra cost of organic. But I'm finding, since I've been doing this so long, actually since 1964, that's with a 6, that in those days, there was no such thing because there wasn't even as many pesticides. They started coming in then. And then we went to where anything organic was way expensive, but now it's so much more mainstream that almost every commercial grocery store chain, like let's say Publix in Florida and Stop and Shop in New York, and you don't even have to go to a special store. They have much more organic available and really like a penny more, not much more. So you can try to make that choice if it's at all possible. Really good idea, because that's something that might be. Now, is there any research showing that PCOS is linked to, certainly it's linked to the hormone dysregulation, but is there any studies showing that it's linked to eating more, high levels of pesticides?
I'm not sure about that. It's definitely, when I talk about nutrition with my PCOS patients, we will talk about that for sure. And one of the most important things we'll talk about is lower carb, higher fat nutrition, because my PCOS patients, when they come in, many of them are the most diligent people with their nutrition, and they're still having trouble with their weight. And the problem that the way that we can tweak that to help them lose weight and have healthier hormones is to go lower carb and emphasize protein and fat, and then also do a certain kind of exercise where they're not doing only cardio, but they're really focusing on strength training and maybe even HIIT. And so these are the nutrition and fitness things that we really focus on a lot, in addition to the toxic exposure.
So that is really prime, because getting, like you said, compliance, like you just mentioned, Dr. Leslie, and it's so true that many people, what is their motivation? So if you have a vague concept about, regulating your hormones, that's one thing. If you have, let's lose weight, very often that can be the motivating factor that really makes them partake in a particular program, especially when you get results so quickly, like just throwing out something like gluten-free. My clients, anyone who comes to see me, has to go completely 100% gluten-free, even reading bottles of salad dressing, let's say, for 1 month. That's a requirement before they come to see me. And that's because a lot of times, boom, that's the end of their issue. So great. It's so amazing. And what is the downside to trying that?
There really isn't. It's, there's so many pluses. And for people with PCOS, going gluten-free really brings down that carb intake and that sugar spike, because gluten just spikes your blood sugar so fast, because it has a lot of something called apolipoprotein. And also, and you might be having some gluten-free products, which can be carby, but mostly.
Oh, yeah, no, they're not allowed to do that. So things that say gluten-free on the label, if we turn that around, that paragraph sometimes is loaded with all kinds of other carbs like tapioca starch and this and that. So no, gluten, just because it says gluten-free on the label doesn't mean it's healthy. It's sometimes loaded. It could be gluten-free and loaded with sugar and all these other things. So I'll offer them something like just plain rice cakes as a swap out food, or just make things in lettuce leaves. I'm very big on that. Like whatever you were going to eat in bread, just use a lettuce leaf and roll it up. And after just a couple weeks, they lose weight so quickly that it becomes very motivational. Of course, it's not the total answer, but almost no one has a negative effect to cutting down wheat, and everybody seems to feel better. They sleep better. They have less mucus when they wake up. It goes so far to feeling well, and you lose a few pounds very quickly.
And gut health. It's so, people, it's if someone has gut issues, IBS or diarrhea, constipation, any of that, it's going to help your gut health a lot. So there is no downside. And you learn so much more about other foods, about whole foods. when you're going through that.
Right, because you need a substitute, because you're not going to have, pancakes for breakfast and a sandwich for lunch and pasta for dinner. That's not on the menu. But there's so many other choices. Just think about it a little bit. I mean, I don't have any gluten sensitivity, but I would say, there's not one thing in my house that has gluten in it, and I eat all day. So it's really not hard, but it is certainly more whole food focused, because when we think about what gluten is, it's in every baked good. It usually comes along with sugar, and it has that high carb ratio and high glycemic index ratio. So it's perfect for what you're suggesting.
Definitely.
So that's how you feel about gluten-free, right?
Yes, I do. And I'm the same way. They don't have to do it before they see me, but it's generally something that we're going to be doing in the beginning.
You're going to be talking about it. It's certainly a really good way. And you do see people lose weight and start to have less symptoms with no side effects. That's the exciting thing.
Yeah, true. True.
Now, what about if somebody wanted to consult with you because they have these kinds of issues, but they're not in North Carolina? All of life has changed because of COVID. Everybody knows you don't have to be any particular place.
Right. We can do that. We work in programs so that we're seeing people for an extended period of time so that we can really get them to feeling good, and so that we can guide them through these things of nutrition, fitness, stress management. We don't skimp on these things, and we really give people a plan with lifestyle and with supplements and labs. So we give them a plan, and we really support them heavily through that plan. And if somebody's interested in talking about that, and if we'd be a good fit to working together, they're welcome to call our office, and we can do a free chat on the phone, a little consult, so we can chat for 15 minutes and see if it would be a good fit.
Well, we're going to link, besides doing our live show that people are listening to now, we're going to have your show archived. I'll also send you a link, and they absolutely can, check in and connect with you through that. We always make it really easy to get in touch. And it was really, really interesting. And I'm sure also, we don't have much time left, but infertility is another thing that I bet you have great results with this kind of program.
I do. It's actually one of my favorite things to treat PCOS with infertility, because we can, usually the issue is that someone's not ovulating. And so we can get them ovulating most often.
I know. It's holistic is excellent for fertility. And how happy is that when there's like babies in the world because, you help someone balance their health. It's just fantastic.
It's the best. It's the best. It's the best news to get, for sure.
So I want to thank you for being our guest today, Dr. Leslie Meyers.
Thank you so much, Ellen. It was a joy, really fun.
And thank you, listeners, for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai at naturalnurse.com, inviting you to join us again next week for another edition of Herbally Yours. Until then, stay healthy.